Good afternoon, guys. Just a minute, I have to readjust something. Okay. Good afternoon. This afternoon's topic is the reluctance of healthcare professionals to talk about death and end of life decisions. So we're going to go through those today for the presentation. Here we go. The article discusses the reluctance of healthcare professionals to talk openly about death. Despite this inevitability, the author shares a personal experience in an emergency department where a physician awkwardly asked a patient if they wanted resuscitation, highlighting the difficulties in discussing end-of-life care. The article argues that the medical field often views mortality as a failure rather than an essential part of life. Key point: healthcare professionals often struggle to discuss death openly and sensitively. The process of making advance directives requires balancing control over medical decisions with accepting uncertainty. Give me 1 second. Medical students should be trained to navigate these conversations, especially in time sensitivity situations. Mortality is a fundamental aspect of healthcare that should be addressed with honesty and compassion. End of life care should begin well before a crisis. Routine check-ins allow patients to express evolving preferences over time. 2. Training for healthcare professionals. Medical education should prioritize communication strategies for sensitive topics like mortality, role playing, exercises, and mentorship can help providers navigate these discussions with confidence. 3. Person-centered approach. Framing these talks around patients' values and goals fosters meaningful engagement. Instead of focusing only on medical interventions, providers should ask what matters most to you. Okay, advanced care planning, encouraging patients to document their preferences through advanced directives or living wills ensures clarity during critical moments. Ex- Inclusive decision making involving family members and caregivers in conversations can help ensure that loved ones understand and respect the patient's wishes. Use of storytelling and personal reflection, sharing narratives about real life experiences can make decisions less clinical, and more uh, relatable, helping patients envision different scenarios, creating safe spaces, a non judgmental, supportive environment allows patients to explore their concerns. About dying without fear of stigma or dismissal. Given your expertise in patient autonomy and person centered planning, do you think these strategies align with your vision for improving healthcare conversations? I'd love to hear your thoughts on this approach, on these approaches. Resonate with your thoughts on most with you. Resonate most with you. Effective communication in end of life decisions requires sensitivity, clarity, and emotional intelligence. Here are key techniques to, to facilitate meaningful conversations. Okay, number one, guys, ask open ended questions so that, me as an end of life specialist, I frequently sit down with folks with a notebook and a pen and ask them, what they would like for end of life care. So, with that being said, I'm going to go through these for you. Number one, ask open ended questions. Instead of yes or no questions, try asking what are your biggest concerns about the future, or how do you envision the kind of care you'd want. This allows for open and for this allows for them to voice what they want for care, guys. Okay, next one. Patients to express values and preferences. Number two, use clear and compassionate language. Okay, avoid medical jargon and euphemism language that can obscure the reality of the conversation. Saying, we want to honor your wishes and make sure you're comfortable is more effective and vague. Terms like terms like making things easier, um, just make it easier for yourself. If you're helping someone make that decision, just let them open up to you. Like I said, I sit with a notebook and let them make the choices. Okay. 3, mirror mirror emotional cues. If a patient is hesitant responding with validation, e.g., it's understandable to feel concern about these decisions, can foster trust and make them feel heard. Okay, 4, normalize the conversation. Framing framing mortality as a part of life rather than a taboo subject can ease discomfort. A statement like many hold on. A statement like many people find it helpful to talk about these choices ahead of time can reassure patients. 5, provide reassurance. Patients and families often fear loss of control. Reinforce their autonomy with statements like, you are the decision maker, and we're here to support you in that. And okay, encourage advanced planning. Discussion should lead to clear documentation of the patient's wishes, whether through a healthcare proxy, living will, or advance directive. Okay, 7, use storytelling when appropriate. Personalizing the discussion through relatable stories. A Like, I once worked with a patient who found peace in knowing their care plan was in place. Can help patients process their own choices. Okay. Second page. All right. 8, offer space for reflection. Silence can be powerful, giving patients time to absorb information and express emotions without rushing the conversation can be invaluable. Okay, guys, like I said, when you sit with a client who's coming into hospice or end of life care, you sit with a notebook. You ask them how they want to set things up. That lets them have control. Okay? All right. Since here's the bottom piece for you on this one page. Since you have a deeper interest in patient autonomy and self-directed care, do you see any gaps in how these conversations are currently approached in healthcare settings? Your insights could help refine strategies for more effective communications. Okay, communication techniques for end of life decisions should be tailored to the needs and preferences of different patient groups. Here's how they can vary. Okay, let me get the rest of this out for you. Elderly patients with cognitive decline. A. Use simplified language and avoid overwhelming details. B. Break conversations into manageable parts to accommodate memory limitations. Engage family members or caregivers to ensure clarity and support decision making. 2. Patients with chronic illnesses, i.e., Parkinson's, Alzheimer's, RA, discuss long-term care preferences early as conditions evolve. Okay, folks. Emphasize quality of life considerations rather than just medical interventions. Use visual aids or written summaries to reinforce key points. Younger adults facing terminal illnesses. That is 3. We're going to go through that now, okay? A, prioritize decisions around legacy, meaning, and personal goals. B, offer psychosocial support, including access to counseling. C, acknowledge uncertainty and provide space for emotional processing. 4, patients with limited health literacy. I'm going to go through that now for you. Avoid medical jargon and use concrete examples for clarity. B, employ illustrative storytelling or metaphors to explain concepts. Ensure clear documentation of decisions and follow up as needed. 5, culturally diverse patients. A, respect religious and cultural beliefs regarding death and dying. Use interpreters or culturally compliant, competent meta mediators when needed. C. Frame decisions in ways that align with the patient's family dynamics and values. 6. Highly anonymous patients who prefer direct communication. Use straightforward language without excessive reassurance. B. Encourage active participation in decision making without personalized data. C. Offer multiple options and allow them to take the lead in discussions. Okay, giving your focus on patient autonomy and personalized care, which of these approaches do you think need more refinement? Current healthcare systems, you might have insights on gaps in implementation, especially in person-centered planning. Healthcare systems can support diverse communication strategies for end-of-life decisions by integrating training policies and technology that prioritizes patient-centered care. Here are some key approaches. Standardized training programs. Medical professionals need education on tailoring conversations to different patient groups. Incorporating role-playing exercises, cultural competency models, and communication workshops into medical circa can improve sensitivity and effectiveness. 2. Guidelines for person-centered care. Hospitals and clinics should adopt policies that encourage value-based decisions rather than defaulting to procedural decision making. Standardized protocols can help ensure patient autonomy and remains a priority. Next one, 3. Integration of advanced care planning tools. Healthcare systems can promote accessible documentation methods for advanced directives using electronic healthcare records to store and communicate patients' wishes across care settings. 4. Technology assisted communication. AI-driven decision aids, patient portals, and telemedicine services can provide support for individuals making complex end of life choices, ensuring that they have access to guidance at their own pace. 5. Dedicated patient advocacy roles. Designing end of life care coordinators within healthcare institutions can ensure patients and families receive tailored support, reducing unnecessary stress. Okay, give me a minute, guys. 6. Interdisciplinary collaboration. Physicians, nurses, social workers, and chaplains should work together to ensure that communication strategies align with the medical, emotional, and spiritual needs of patients. 7. Community engagement and awareness campaigns. Public education initiatives can normalize and end of life decisions, encouraging individuals to think about their preferences before a crisis occurs. Okay, here's the bottom piece on this page for y'all. Given your focus on self-directed care and autonomy, do you see particular gaps in how healthcare systems currently approach these strategies? Your insight could help refine approaches for better patient engagement. Okay, guys, that is it for today. I'll see everybody for B later tonight, or tomorrow. For now, Gator Wellness, take care, folks.